autoimmune disease also. It is not an allergic disease as such, but psoriasis is something which cannot be cured as such. It remains all the time with you. तो क्या है सोरियासिस? बॉडी में ऐसे स्केल्स आना, ब्लीडिंग होना, स्केल्स, सिल्वरी स्केल्स निकलना, वहां पे जलन होना, पेन होना, and when you open that, there is a bleeding spot which is called as the Cobner's phenomena. Now, after many years of practice, I am telling you, friends, no other pathy can offer as much a complete, long-lasting treatment than homeopathic medicine. Doctor, you have seen a couple of cases, right, with me. That uncle who came, we don't want to take name. Remember, he had so much of extensive psoriasis on. Want to sit here, doctor? Come, so that you can. That's Dr. Netra, my young colleague doctor. I am privileged that last 15 years of my practice, I've always had amazing students who we do a lot of knowledge sharing together. We, Dr. Shreyas, Dr. Payal, then Dr. Vidhi, and to name a few, Dr. Sapna, Dr. Manisha. So these young boys and girls, doctors, are very good in their materia medica, medicine. So it's great. That's Dr. Netra. I would like to introduce this very, very hardworking, smiling young doctor. Doctor, how are you?
Fine, sir.
Great. So, doctor, how was it? Remember that case of psoriasis which you just saw? You can, whenever I talk to you, you can just peep inside like that.
Yeah.
Okay. So remember, and that patient was feeling so better.
Yes.
And can you share a drug of choice? What we gave him?
Sorry, ma'am.
No. We gave him Soranam. I think just one dose we gave him, right?
Yes.
One dose.
200.
And then
Soranam.
5 time is going on, right?
Yes.
And the patient is feeling so better. He got his wife also. She's also feeling better. So point is, in cases of psoriasis, in lichen planus and eczemas, we don't like generally to repeat.
Yes.
We give one medicine and wait and watch for the remedy response. And most of the times, the remedy response to sulfur 1M or to sorinum, or rather I would say to the constitutional and indicated medicine, is that the patient start improving. So the discomfort becomes less, the itching becomes less, the scales which come out becomes less, and the patient overall feels better. I just went to Kolhapur for a conference, and there I presented a case of a lady who was not going out of the house for last 6 months or 8 months because she was scratching all the time. There was so much of discomfort, and she said, "Doctor, I feel so embarrassed to go out, so embarrassed." ठंडी का टाइम भी था, and she said कि ठंडी में बढ़ जाता है ये itch, and based on that symptom and other symptoms, we gave her Sorinum 1M 1 dose, and we have this a testimony that the patient says कि डॉक्टर साहब, आई एम फीलिंग so much better to such an extent की मैं अब बाहेर जा सकती हूँ. मराठीमध्ये म्हणते की मला बाहेर जाता येतं आता, आणि मला थोडंफार बरं वाटते आता. आय एम नॉट फीलिंग दॅट discomfort. I'm not scratching all the time. People are not asking me questions. Okay, that's the whole miracle, I would say, of homeopathic medicine when the right selected medicine is there. I would request here to all my colleagues, what I have learned, small things from my teacher, Dr. Eno Goel, principal of CMP Homeopathic Medical College, ex-principal, but commanding great respect, great knowledge of materia medica. He used to tell us, if I can, I do mimicry also, right? So never repeat, I tell you. In cases of skin, just give one dose and wait. Never repeat. सर, अगर आप सुन रहे हो तो मुझे माफ़ी चाहता हूँ सर, मैं आपका लाडला भी हूँ और शरारती स्टूडेंट भी हूँ, पर आपका बहुत मुझे प्यार मिला है. And today also you will agree that I call my seniors, my great teachers, to take advice कि क्या करूँ, because they have had a practice of 50 years. We are nowhere in knowledge in compared to these teachers. So I am privileged to be with good teachers. So friends, coming back to the point, I am not going to present any materia medica or cases right now here. I already presented cases, but just want to share with you that management of psoriasis with homeopathy is excellent. I don't claim to be having a cure for it. And you know how doctor I am. I don't make big claims कि ये किया वो किया. मैं एक simple आदमी हूँ. छोटा सा आदमी हूँ, पल दो पल का शायर हूँ, पल दो पल मेरी कहानी है, पल दो पल मेरी हस्ती है, पल दो पल मेरी डॉक्टरी है। डॉक्टरी तो चलेगी मगर मैं छोटा आदमी हूँ, इसलिए मैं बड़ी बात नहीं करता। यू नो, simple things I can manage better. But patients of psoriasis coming with extensive psoriasis, uncomfortable, पैर भर गया है पूरा, itching हो रहा है, bleeding हो रहा है, उसके साथ आर्थ्रोपैथी है, मीन्स देर इज अ जॉइंट अफेक्शन, पूरा काला पड़ गया है स्किन, ऑन हेवी मेडिकेशन, स्टेरॉइड्स, ऐसे लोगों को हम दवाई दे के ठीक करते हैं एंड बहुत हद तक इनको अच्छा लगता है। दैट्स व्हाई फ्रेंड्स आई एम टेलिंग यू, जिसको भी प्रॉब्लम है सोरियासिस का एंड ऑल दैट, यू मस्ट गो टू अ लोकल होम्योपैथ एंड गिव योर केस, और you can also contact us. We see a lot of patients online and we'll try to help to our level best. So doctor, can you share which remedies have come up in last couple of weeks you're here practicing with us? कौन सी दवाइयाँ आई हैं psoriasis treatment में?
Sulfur. We have given sulfur.
But we don't repeat sulfur, right?
Yeah, we don't repeat. Just sulfur 200 one dose.
Okay.
Is efficient.
Go ahead.
Then graphitis. Sometimes we give Heparsulf for burning.
Remember, graphite is just a patient had come 5 minutes back, and Mr. Chandrasekhar, right?
Yes.
And he was being given graphitis, and he's felt so better. Graphitis is a very important drug. I'll start taking drugs also very soon now. So graphitis helps in most of these cases, but remember, graphitis has a sticky discharge. Okay, a sticky discharge is characteristic of graphitis. Petroleum, you will never forget, is for trade eruptions. Patients who are like a mechanic or plumber and they have constant dermatitis, contact dermatitis in relation with their work, one can think about mesallium. So this is the broad management of these cases. So I intend to do this video not just for patients but also for our practitioners, to tell them that this is one area where homeopathy can really act well, and probably I would like to say this, but it has an edge over the other pathies, and we can really tackle cases of psoriasis better over long term. Suppression with other medicines is possible. Patient feels better, everything is chakachak, but it comes out. Anything you suppress comes out doubly. If I tell this young girl, don't eat ice cream, don't go out with friends, don't do this, don't have do भंकस, वो सुनने वाली है क्या? अरे हमने किसका सुना लाइफ में यार, अभी भी बाप का सुनते नहीं अपन यार। तो बोलना नहीं चाहिए, हमको कहना चाहिए नेत्रा जो करना है करो, मजा करो। अभी भी श्रेयस को बोलता हूँ मैं, माय क्लोजेस्ट कलीग, जो करने का कर यार, धमाल कर यार, राइट? सो फ्रेंड्स, some patients have gathered and I need now to close. Hope this discussion helps you in some way, right? And all the best to all the prescribers and practitioners, and all those patients who have this problem must consult a good homeopath in local area. All the best, friends. See you then. Okay, stop.